Today we're going to talk about seborrheic dermatitis and its treatment. So before we go into talking about the treatment, I want to talk about the presentation of the disease. So what you can see here is a person that has a very moderate to severe seborrheic dermatitis, and see how it affects these areas on the skin, on the face, and how it looks. Some people have very pronounced flaking around the face, around the nose, and it's very painful. It hurts. It comes and goes depending on the season, depending on the amount of stress, depending on your diet. For some people, it doesn't go away completely. For some people, it does. But today, we're going to talk about the treatment and what else can we do. The treatment hasn't changed in many, many years, and it remains the same and is usually effective for about 85% of patients. The other 15% may not have the same relief of their problems because of the amount of sebum that they produce, the amount of disease that they have, how recalcitrant is their disease. But for most patients, the basic treatment will work. Now, before we start talking about the treatment that I prescribe for my patients, I want to say that you have to know that seborrheic dermatitis gets very, very impacted by your diet and lifestyle. So to all my patients, I always recommend that your diet has to change if you want your treatment to succeed. So for seborrheic dermatitis, anything that can cause more inflammation in the skin can make your dermatitis worse. So anything that has a high glycemic index, like processed food, processed sugars, processed breads, have a likelihood of making your dermatitis worse. So that's one. Second one is alcohol. Alcohol in any amount can make your dermatitis worse, especially if you drink heavy amounts. It will make your dermatitis resistant to any treatment. So take those two away, and now we're going to talk about the treatment itself. So I divide my treatment in two phases. One is the acute phase, and one is the maintenance phase. The acute phase is where we're going to hit or try to hit your skin hard to bring that inflammation down and regain or get that skin back to good health. That's why it's so intense. It lasts 7 days. And what I recommend is for you to get these three products. One is a ketoconazole shampoo at 1%. It usually comes under the brand name of Nicerol. And second is the hydrocortisone cream at 1%. And third is the best moisturizer cream that you can. To me, the one I use for my maintenance and acute phases when I get the disease flare up is the Nustela moisturizing cream. You can get anyone by Eucerin, by Cetaphil, by Aveeno, anyone that you want. Just make sure it's a gentle one without fragrance, without any added alcohols. So moving on, for the acute phase, what I like to say on the acute phase is we have to hit it hard and we have to treat dandruff at the same time, because dandruff and seborrheic dermatitis go hand to hand most of the times. And if you have any amount of dandruff, it can make your seborrheic dermatitis worse. So don't treat just the face, treat the head too. So what we're going to do is we're going to take showers, or we're going to wash our head with the ketoconazole shampoo 3 times a day for the first 7 days. 2 times a day, okay, 2 times a day. You're going to create a good amount of foam and bring it to your face, especially to the areas where you have all these flakes. Rub it, try to take away all the flakes, try to remove them, because leaving them there will make your dermatitis more resistant. So just try to get them out of the way gently, just using your fingertips. Don't use any scrubbing machines or any devices to try to get these flakes out. And once you finish your shower, dry very carefully, and now apply the hydrocortisone cream at 1%, or apply all over this area where the seborrheic dermatitis usually goes. And after the hydrocortisone cream, use the moisturizing cream, the one that you prefer, 2 or 3 times a day. Same with the hydrocortisone cream, 2 or 3 times a day. Anytime that you wash your face, apply the hydrocortisone cream and the moisturizing cream, hopefully 3 times a day. This is for the first 7 days, and only 7 days. Why? Because the use of a steroid cream in the skin can cause a weaker skin, a skin that is more prone to sun damage, to darkening. So there we go. First phase, the acute phase. Now, at the end of this acute phase, you're going to see improvement on your skin. Of course, you're going to see improvement because you're using a steroid cream and you're being very intense on the treatment. And hopefully by this time, you avoided alcohol, greasy food, and you're going into a path of success. Now, entering the maintenance treatment, we're going to focus on the shampoo only 2 times a week or 3 times a week. And we're going to use the moisturizing cream 2 or 3 times a day. Usually 2 times a day. I use it 2 times a day in the morning and at nighttime before going to sleep. That's my routine, my skin routine, to prevent seborrheic dermatitis to flare up or to show up, because at this point I haven't had a flare in about 6 months. Usually things that make my flares worse are stress, or if I forgot to use my moisturizing cream for 3 or 4 days, then it comes back. So there you go. That's my treatment plan for seborrheic dermatitis, and hopefully it helps you. Hopefully you find relief on your skin problems with this. It is a lot of trial and error. This treatment that I just described will work in about 85% of people. I like you to think about this as give it a chance, because many people come saying, "Oh, I already tried one of the elements of your treatment and it didn't work," but you didn't try all of them together, and you didn't try them without drinking alcohol, without having a fatty diet that will definitely change the success likelihood of your treatment. So if that wasn't the case, try it all together and see if there is a difference or this makes a difference. I think it will, but there are cases where patients have a different amount of sebum, they have a different amount of dandruff, and the treatment may need a stronger steroid cream. We have different steroid creams, different steroid shampoos that you can use, but the basic treatment comes with hydrocortisone, ketoconazole, and a moisturizer on the acute phase. So give it a chance, and if this doesn't work, then yes, you will need to talk to a dermatologist or someone that specializes on seborrheic dermatitis. I say that this works for 85% of my patients with seborrheic dermatitis, especially for the young ones. So good luck to you, and make sure you wear a hat, or make sure you wear some sunscreen when you're using this treatment with hydrocortisone cream.